The Prime Minister announced today that 86% of frontline workers in New Zealand have received at least one dose of the COVID vaccine, with a further 538 MIQ workers still unvaccinated. It's a year since managed isolation and quarantine facilities were established in New Zealand. Today, a third MIQ worker at the Grand Millennium Hotel facility in Auckland tested positive for COVID-19. Like the second worker who tested positive for COVID-19 last week, neither have been vaccinated. Healthcare workers are now being vaccinated, and a full national rollout of the Pfizer-BioNTech vaccine is expected for the whole population by July. Dr. Jagadish Thakur is a senior lecturer in communications at Massey University in Wellington, and he spent most of the past year working on understanding how people feel about COVID-19 vaccines and being vaccinated. Kia ora, Dr. Thakur.
Kia ora, and thank you for having me.
Great to have you. Let's start with your research.
Sure. So we did a survey way back in June, July 2020, where we were uncertain when the vaccine would come, if it's going to be efficacious or not, and when it will be available for the public. And then we did another survey in March this year, and what we found, and quite remarkably, was that a quarter of the population is still hesitant about taking a COVID-19 vaccine. So in a way, it's remarkable consistency in vaccine hesitancy, which is both surprising and shocking because, compared to June, July last year, we now know vaccines are safe. They're approved by professionals right here, by scientists and medical health experts right here. It's already being administered in a lot of countries. But in spite of all that, it's surprising to see a quarter of New Zealanders still hesitant to get a COVID-19 vaccine.
So just recap, July 2020, you had a nationally representative sample survey. How many people?
1,040. And this time around in February and March, we got 1,080 respondents.
And the results in July 2020 and March 2021 were both 25% for both. Hesitant.
That is right. That is right. It's remarkably stable for some reason. I think people's concerns, in spite of so much data, information, evidence, and even social proof of seeing, people in other countries getting vaccinated, hasn't decreased the vaccine hesitancy.
How many of the people that you surveyed in July were the same people that you surveyed in March?
Those were two different surveys, actually. So those were nationally representative. They give us national estimates to compare, but we didn't track the same respondents. But between our March and April survey, we will track some of the same respondents. So we'll track at least 500 of the 1,000 respondents that we surveyed in March.
Why do you think you've got the results you've got?
It's quite surprising, and we haven't, dwelled deep into the data yet. But when we ask them, what are the main reasons for their continuing hesitancy, what information they require, a third of the respondents say vaccine safety. They need to see more data on vaccine safety. Second on the list was social proof, seeing others take the vaccine first. And you see this even in UK and the US, where people who are hesitant came around to taking the vaccine once they see the family and friends, the people in their neighborhood taking vaccines. So I think that might change even here in New Zealand. People might not want to take it in a survey, but once they see people around them taking the vaccine, that might change. The third on the list was having their doctors recommend them about taking the vaccine. So those are the sort of the three main reasons for hesitancy: more information about vaccine safety, seeing others take the vaccination first, and doctors' recommendation, their own GPs recommending that they should take the vaccine.
I'm interested why you redid the survey in March when we have yet to have the national rollout of the vaccine.
Yeah, so we wanted to get sort of an understanding of how much that would have changed. And we did it just because we wanted to understand before the government releases a national campaign on vaccination. So we wanted to have some good data to be able to contribute to the public and policy discourse on how has the public opinion shifted over the past 9 to 10 months.
And there's been no shift.
Yes, there has been no shift. In fact, we also did additional experiments. So we showed them, one of the conspiracy things that has been quite popular on social media. We showed them a news story that was in print. It was also published online, but later removed by a national newspaper here. And then we showed the COVID-19 vaccination approval and announcement by the government. And we found that people who are exposed to the misinformation on social media, 25% of them say that after reading it, they are less likely to take the vaccine. Even with the mainstream news coverage about a mom declining COVID-19 vaccine to their son, has also influenced about 20% of our respondents and resulted in a sort of a decline in their intention to take the vaccine. However, when after reading the government report, only a minority, who I think are the strong skeptics who are already skeptical about the vaccination in general or in COVID-19 vaccination in particular, they remain skeptic. But otherwise, the first two, the social media misinformation on vaccine, and the news report that got published on vaccine hesitancy by a mom towards a child, those were quite influential.
Who's using your research, or who do you want to have your research used by?
We'd like, we've shared this with some of the people who work in as government advisory boards. So we're hoping that they would take this research, share it with people in the policy-making process, so that, when we communicate about why people should be taking the vaccine, people, would pay attention to it, will process the information, and hopefully change their behavior. So one of the interesting results that came out from our February-March survey was that when we asked them, how sure are you about taking a COVID-19 vaccine, just over half of New Zealanders say that they will definitely take a vaccine. But when we asked them, would you take a vaccine if it was to protect your family or friends or at-risk groups, more than 6 in 10 New Zealanders said that they will definitely take a vaccine. So it's just that simple messaging about altruism, we should do it to protect, family and friends and people who are at risk. Altruism could be an effective message strategy in the COVID-19 vaccination health communication campaign.
Why do you think it hasn't been used yet? Or has it, but just not effectively?
So I have listened to some of the radio ads do mention it, that why you should be taking the vaccine to protect, but I don't think it has been a out-and-out communication campaign, actually. So I've listened to it in some of the radio ads, but that messaging hasn't been consistent. In public health, we say simple, clear messages repeated often by a variety of trusted sources is a mantra for effective public health communication. So I think we need to keep repeating the information via different trusted sources. So we also found that some people trust scientists and, they tend to be very supportive of taking the vaccine. But other people are very distrustful of scientists and the government. They only trust their family and friends, their opinion leaders in their community. So for them, we need to reach through more localized communication campaigns. For them, doing a mass media campaign or a social media campaign won't be effective because they already distrust these mainstream sources of information.
So who would trusted individuals be to deliver this messaging?
So I think apart from the scientists and, public health experts, Prime Minister Jacinda Ardern herself and, other experts, who will likely be appealed to people who are already convinced that they should be taking a vaccine. But for the people who are hesitant and skeptics, for them, I think local opinion leaders, their religious leaders, somebody in their community who also dwells in health services, for example, seeing people like them, asking them to do behaviors, that's what they're most likely to follow. So I'm most likely to listen, trust information from people who look like me, who speak like me, who have lived the kind of life that I have lived, rather than trust some expert, whom I already distrust.
When will you be carrying out the research again?
So we have another longitudinal survey that's going to be implemented in April 20th, in a couple of weeks' time. So we are tracking the people who already responded in the February-March survey to see how their opinions might have changed in a month or so.
Look forward to speaking to you again and finding out what your next results will be. Thanks so much.
Thank you for your time.
That was Dr. Jagadish Thakur, Senior Lecturer in Communications at Massey University in Wellington.